So should we get started, perhaps? See, there's over 100 people here. So welcome, everyone. For those of you who do not know me, I'm Evelyn Anderson. I'm the president of ArizOTA. This is my second year as president, so I'm finally getting to understand a little bit of what this position is about. But when I'm not the president, I work at Huntington University in Peoria, starting the OTD program there. And it's so great to see you all here. This is our second ArizOTA Town Hall this year, and this one is focused on school-based issues related to our pandemic. And it's very timely. We have received a lot of questions from practitioners now when schools are starting up again. So that's why we are having this town hall. We can take the next slide. So just some housekeeping issues. So the webinar is 90 minutes long and we are recording it. So you will have access to it on our website after if you do not have time to attend to the whole thing. And you will also have access to the slides, which they do have a lot of good information on them that you may want to refer back to. So the first part of the webinar is a presentation of, so we have some introductory slides, but most of the time is really focused on your questions and comments, concerns, suggestions. And as you probably can see now, you have been muted, and that's just so we can reduce the background noise. But there is a function where you can raise your hand. You click on that and then you will be unmuted and you can ask your question. We are also encourage you to type in questions in the Zoom chat. So that's the chat function that you can go to, and there you can type in all your questions. And we will address those at the end of the presentation tonight. And if we run out of time, well, then we will post them as well on our website with answers to the best of our knowledge. And something that's good to know as well is that ArizOTA is a volunteer organization, right? So we don't have any legal authority, but the information that we present, we have gathered from all our members who are experts in their respective fields. So we're giving it as guidance and support, but we are not the licensure board, so we don't have the legal authority. And if you have any questions that you feel did not get addressed during the presentation, you can also email us afterwards at office@arizota.org. Yes, next slide. So just wanted to quickly introduce our board and legislative committee and SAS chairs and our marketing person. So you have already heard our marketing person, that's Ashley Gustafsson. We have two special interest section chairs who have been instrumental in putting this town hall together, and that's Christopher Trujillo, and he's the transition SIS chair, and Mary Schmitz, who is our new telehealth special interest section chair. So we actually have a special interest section now on telehealth. And of course, our legislative committee, Sudal Popolicio and Wade Mcdowell, they co-chair the legislative committee. And we have listed our current board members. You can see them to the left there. I'm not going to go through and read all our names. You can read them yourselves, but they have all helped out with this presentation as well. I should mention though that Benjamin Gross, who is our past president, is also the vice chair now of the Association of State Association Presidents. So he has a national position and we are very fortunate to have him with ArizOTA as well. Next slide. We also want to thank our experts, and these are all school-based occupational therapists in Arizona who responded to our call for help with this, to plan this town hall. So we were just amazed on how many people volunteered and contacted us and participated in our planning sessions and helped answer the questions that were sent in ahead of the town hall. So thank you so much. And we can go to the next slide.
And we can introduce Wade Mcdowell, which Evelyn, you've already introduced. He's one of our legislative committee co-chairs, and he's going to take over from here.
All right, good evening. So I want to first acknowledge that Sue and I are deeply appreciative of Vita Colmer in her assistance both as an occupational therapist and as an attorney throughout this last year and a half or so. It's really been quite a whirlwind. We also continue to work with our lobbyist, Lauren King. So just in terms of background, I want to point out that there are several elements that seem the same yet are different. There's a difference between legislation, the Practice Act, which is of the state board, the rules and regulations of the state board, and as well as rules and regulations of other state agencies and state programs such as Board of Education and Access and those kind of things. I did get some breaking news. I haven't been able to delve into it, but this afternoon I got a notification from CMS that there is a proposal to continue telehealth after the pandemic. Of course, the devil's in the details, but it's clearly a positive sign. Oftentimes in healthcare, we say, as goes Medicare, so goes the rest of the world. And so that's why it's a pretty significant event, even for a topic such as this, for school-based therapy. Our executive order permitted therapists to use telehealth and mandated parity for payment. HB 2536, which was the bill that we had before the legislature that had cleared the House, had cleared committee in the Senate, and was pending a vote in the Senate, only permitted telehealth, and it did not include payment parity. Obviously, payment parity is a significant hurdle and a significant benefit. It's one thing to be able to do a thing, and it's another thing to get paid to do the thing. In this case, telehealth. Our next challenge really is to make permanent in a variety of ways the telehealth ability here in Arizona. And so I think I have some more on another slide. Let's go ahead and advance the slides, please. So clearly the wording was geared towards medical model OT practitioners in comparison to school-based therapists. But in reviewing the postings on the state board, I think it's pretty clear that any licensed occupational therapist in the state of Arizona can use the intervention model of telehealth. It's not really an intervention model. I would say a practice, a service delivery model. And I think that's pretty well covered, at least from my reading of it. Let's see. Okay. Let's go ahead with the next slide. I'll try not to just read the slide. That's kind of a pet peeve of mine. So what does the executive order cover? The executive order covers the period of the pandemic. So the period of the pandemic is as long as decreed by Governor Ducey. At such time as that is declared over, what we're working on, and this is behind the scenes, it's pretty preliminary, so I don't have anything specific to report, but is the possibility of an executive order that bridges the time between the end of the pandemic and the time that legislation may actually be enacted and become law at that point. This is a lot of the work that we're doing currently via our lobbyist, and one of the things that is pretty significant is that the Arizona Medical Association that represents the physicians is really kind of taking the lead in that and is running point representing all of us in healthcare, including, I want you to know, occupational therapy. So that's kind of the stepwise process as we see it. Let's see, you know, in terms of charter schools and other practitioners, I would hope that they are licensed in the state of Arizona. That's a requirement. I have a license in Colorado. Technically, I suppose I could practice in Colorado, but I don't. I'm happy to be here in Arizona. Okay, next slide, please. Okay, so there is some discretion when it comes to enforcement for telehealth. HHS, the Health and Human Services Administration Office for Civil Rights, there's a link here that will be provided to you. You can read the source document yourself. I know we said this in the last town hall, but I want to re-emphasize, please read the source documents as they apply to your practice. It's very important, and it will help you have confidence that you're doing the right thing. Or if you need to make a case for changing your practice to an administration, a supervisor, something like that, then you'll actually have the details to do that. So there's been some loosening, I guess, of what kinds of enforcement might be done in order to serve students, to serve patients throughout the country. And you can see these links here. FERPA has special requirements in the schools, as I understand it. That's not my area, so I'm going to defer to the experts that we have on the panel, and so grateful that they're here with us tonight. I certainly couldn't be a significant part of that, but you'll see those comments there. So again, it's privacy, and what is private? Well, do you have password protection? Do you have encryption? Is the therapist in a private location, or is the therapist trying to do the session from a Starbucks? Is the child or the family in a private location within their home, or are they trying to do it from Starbucks? You know, those are things to really consider in setting up. I know on the medical side that's been part of the coaching we've had to provide to patients is how do we set up their space in order for it to be more successful. And I think our panel is going to really get into that and give you some helpful tips there. Do be careful about, I'm not sure what PII is. I'm assuming that's personally identifiable information, and don't publicly display students' information because someone else might see it or someone else might see it on their end. Next slide, please. So licensure is required in the state where the patient or the student is located. Like I said, I have a Colorado license. I could practice telehealth in Colorado, even though I'm located here in Arizona, or, you know, who knows, maybe I win the lottery and move to Maui. I don't know. But OTA supervision, then this has come up. And at this point, it's our understanding that the State Board of Occupational Therapy Examiners is declining to further clarify. They are aware, I can tell you from calls that I've been on, that it's a bit of a conundrum. And they would seek to clarify that in the future, in particular, when, I'm going to say positively, when telehealth becomes a permanent option here within Arizona. We can't give any further guidance on that, but sound ethical practice, I think, will really guide you and offer you really the correct answer. You know, we serve our clients well in an ethical way that we try to protect their privacy and meet the supervision requirements. I know it says face-to-face, and there's discussion about does video allow that, such as what we're doing, and the board at this point is silent. I think I have one more. So appreciate Vita's input on this slide as well. What if a student gets hurt while participating in telehealth with the parent support? Parents, homeowners, or renters insurance could cover. Health insurance may cover. Most business policies don't cover students out on the school grounds, but check with your school to see if there's does, especially now, and where you're covered. If somehow the therapist is liable for the injury, I suppose you could be held responsible for that, and your malpractice would cover that incident. If you're providing these services and that's a concern to you, AOTA has some discounted malpractice insurance, and there's other providers as well. I haven't had it personally in many years, but when I did, it was very, very inexpensive. In those days, I think it was $60 a year or something. It's maybe a couple hundred. So I don't know what it is now, but I would encourage you to investigate those options. If you're self-employed, be sure to check with your insurance carrier and either add a rider or take whatever steps they recommend just to make sure you're covered from a malpractice standpoint. Informed consent is going to be Chris. Take it away, Chris.
Yep. So at this point, if your district is providing telehealth or teletherapy services, then your district should already be thinking about this. And many districts already have policies in place. People have scrambled to ensure that this is implemented. But if your district hasn't and they're seeking your guidance to get that in place, just ensure that that there is a signature page in place, at least one, for the parents and the guardians to agree to those types of services. Although it's occupational therapy, you know, just as it was in the school system, it's delivered over a different format, and so you want to make sure that the parents are aware that it will be different, that there's a possibility for you to see and hear everything that's going on in the room, and so some of that is already covered in the student's IEP. You already have informed consent to provide treatment, but the moving forward on future IEPs, you can ensure that that you include it in the prior written notice, or in when you give the parent their legal rights. And so using different systems to capture their signature and ensure that they do understand that the therapy is going to be different, and that there are differences in the confidentiality. So it really is up to your district's their decision, because you can't make them do anything. Different districts are allowed to interpret the law how they want to. The IDEA 04, and so they may not even be providing telehealth services. But it is a good idea to encourage your districts to consider this, and so we have included a copy of an informed consent that can be utilized or adapted for your district. You'll be provided with that link. And then ensuring that that you get it just that one time, and that parent or that guardian understands that you are going to be providing the telehealth services. You don't have to do that every time that you see that child face to face. And we're going to discuss groups later, and so that adds another kind of monkey wrench in the mix. And when you have a group, it creates a situation where multiple children and multiple parents are going to be seeing each other's children. And so if your school is already providing virtual education, then that's already occurring. And so your school has already thought about FERPA, and kids are already seeing one another, and parents are already seeing one another. And so some of those are can be wrapped into the FERPA considerations and not so much HIPAA like we're used to in the medical setting. Okay, would you advance? So just some points to consider, even in that form that we gave. Just make sure that you have documentation that parent understands that that services may be provided in a group, and that they understand that that they may need to be present during that therapy session, especially if the child has a significant disability. You're going to want that parent to help facilitate some of the activities and services that you're providing, and that's great for follow-up, and it will probably make the therapy even better because that parent's involved. You also want to have an indication that they actually have the ability to engage in those therapy services. Do they have internet access? Do they have a computer? Do they have a microphone? Is there audio present? You want to make sure that they sign and that they indicate that they understand, that they give permission to for their student to participate in that therapy. And again, you know, it may be called telehealth, teletherapy, or virtual therapy. So excuse me, I'm going to take a drink of water. So I'm going to mute myself just 1 second, then I'll unmute. I've been teaching online, and there's nothing I hate more than that kind of sticky sounding. The speech therapists love it, and they love it when I stop and take a drink, but we're not really mouth people. Okay, and then you want to ensure that there is a signature on there, their dates, of course. Those are kind of no-brainers. Will you advance forward? So you also might want to include a letter or attach a narrative to your permission, and so you have to have an explanation as to why that teletherapy is being offered, the type of services being offered, you know, OT, PT, speech, and it would be good to all be on the same page and have that consistent, because you may just have to send one form for everybody. An explanation of that teletherapy and what it looks like, as well as why that parent should be present, helping them to understand that it's important. You really need to build rapport, and we'll address that a little later also, because that parent is going to be, they already are a part of your IEP team. You know, essentially, if we did IEPs the right way, that parent would be sitting there and we would write the IEP at that time. And most, you know, schools, we don't do that, but we do often give a copy to the parent ahead of time to review and to give their input. But ideally, you know, that parent is already involved and is vested in the team and in their child's education. And so this is their child's education. It's just being conducted in another format. So ensuring that parent understands that you are there to help. And if the child is independent, then you don't have to have them there every moment. So also, you need to let them know the items that they're going to need to have in place during that therapy session, and your contact information, of course, and how you're going to schedule therapy, which is one of probably the most challenging pieces. So when it comes to providing teletherapy, though, in another state, you have to be licensed in that state. So I would think it's the exact same situation when it comes to the school. A school should not be providing education to a child in another state either. And so that's an issue to discuss with ADE, I imagine. And then in terms of parents being present or not being present, when you have a child with a significant disability who's unable to move things themselves or with their own hand, you have to have the parent present. But if the child can do it on their own, then the parent can't be. It's a new world and it's a new situation. And so typically children, when they're in school, their teachers providing those services. But that parent can be an e-helper. That's the language that is used to facilitate some of the services. Okay, please advance. So is teletherapy consultative or direct? really you are going to need to ensure that you're following the direction of your district, because there are several districts that don't even allow consultative services. Teletherapy can be direct. It can be a one-on-one service direct. It can be a group service. And really it is, it's just a means of delivery of your OT service. And we are legally allowed to provide that at this point. And as Wade had said earlier, we hope that that's going to become a permanent capacity for us. And so you are able to provide that service. And so helping your district understand that you can provide those services is important. Most districts should have something in place right now. And if they're scrambling, then I would encourage you. This is a platform where we can kind of overcome those boundary issues that we have between districts and the competition between districts. And we can talk with one another and find out how do I do this better. So also the IEP, you want to ensure that you have collaborated with the IEP team. Everybody's trying to implement the services that are outlined in the IEP in this new setting. And if services cannot be provided in a new setting, then maybe you need to consider amending the IEP or holding another IEP meeting, conducting a new IEP, and then when the child comes back, conducting a different IEP. And so that's only in the case where things cannot be implemented in the exact way that they've been. So you can work directly with that child. You can consult with the parent. You can instruct the parent on what to do with the child. The parent can be an e-helper, but it is direct services. You can count those minutes that you're consulting. And again, that's follow the guidance of your lead therapist. So AT, other supports, they may change with virtual learning. And that's just like if you have a child you're working with, they may require different services as they go into different classrooms, or as they transition to a different grade, or as they move to from elementary to middle school. And so it's always being cognizant that this child's needs may change. And so don't just think of it statically, like this is exactly what the IEP says, so this is what I need to deliver. Yes, it's true. And by law, you're bound to that IEP, but you and the team can meet and discuss changes that need to take place in that IEP. You're still functioning as a school employee or as a contractor for that district, and that IEP is a living document. And again, different districts may have different interpretations. So some may not even allow you to provide consultative services. You need to work with your school district. Okay, go ahead and advance. So what's billable? Working directly with the student and that virtual platform, working with that parent, that caregiver, that coaching that child. You want to include that child at least as much as possible, at least at the minimum where the parent is demonstrating that they understand. But really, you're a school-based therapist, and so your treatment has to be educationally relevant. You are a medical provider, but you're not providing it in the medical setting. And so collaboration with a home-based OT, that's fine as long as you have consent from the parents to do that. But that home-based therapist is not going to be able to provide your treatments. You're providing a complete different set of treatments than they are. Also, if your resource teacher is acting as your e-helper and you're providing therapy with that student, then that's a Medicaid billable time, just as if you were pushing into the classroom, which is good therapy. If that resource teacher is working with the student and you're observing and providing feedback to that resource teacher on accommodations, that is an indirect service and not necessarily billable, but you can use that as consultation IEP minutes if that is permitted in your district and if you have those type of services outlined in the IEP. Please advance. Okay, so rapport. You've got to build rapport with that family member. and ensure that they understand. You know, everybody's under stress right now. Everybody's having to deal with this COVID thing. No parent who had their child in public school signed up to educate their child in their home. No, nobody did that. If they wanted to do that, they would have been a homeschool parent. And so, you know, ensuring that they understand that you understand, and ensuring that they understand that they're a part of the team and that you're just there to help. I think that's a good way to begin that rapport. Check with the district and ensure that, okay, let's see, check with the district standards, as typically parents cannot pick and choose special education services. If there's an identified need, consider a consultative model. And again, that's the thing, is if you need to move forward, if that child is not attending or able to participate in the therapy, if the parent is unwilling, then you may need to revisit the IEP and talk with your IEP team. But that IEP team is a good resource for you. If they opt out and they decide not to participate, make sure you document that. You know, document it, attempt multiple times, document every interaction that you have with the parent. And again, you may need to revisit the IEP and edit the IEP. Provide clear expectations of that caregiver, that parent. Make sure that they're present, supervising if it's necessary. If it's not necessary, you know, you can just consult with the parent and ask them to follow up with certain items, certain actions with that child. So groups, as I had mentioned earlier, you really may need to get consent from the parents to ensure that they're okay with you treating multiple children at a time, and that at any point you could have a parent walk behind you or walk behind that child. And so ensuring that they understand that that it's a situation where multiple people could be present. And that language can be covered in that consent form. So legally, we haven't received guidance on group size, but just practice ethically, you know, according to your own personal ethics, the code of ethics as outlined by AOTA, and ensure that you're providing good therapy to the best of your ability, in addition to following the guidance of the school district. And then don't share personal information during the group settings. Good. Okay, and then Nick starts at assessment, so I'm still going. All right, reimbursement. So if your school is enrolled in MIPS and they're providing the Medicaid billable services, then your district should be figuring out how to add a modifier to those codes that you're billing. And they should instruct you to either continue the same way that you have, or if they direct you to utilize a different code, then utilize that. But really, the question was, can local education agencies receive reimbursement for Medicaid through telehealth? Yes, they can. And Access is allowing us to bill. There was another question that just popped up. Let's see, is this also related to providing therapy for IEP time or just billing? So always with everything, I mean, you have to document anyway regarding compensatory services, and you're monitoring to see if the child regresses. And so there may be a parent who comes, you know, weeks later or towards the end of the year, and they say, you know, because of this COVID thing, my child regressed, and they're no longer performing their skill the way that they were. Then at that point, you'll have to evaluate your data that you kept regarding that child's skill. And so the skill that you want to outline in the present level, and the skills that you're working on in goals is what you should continue working on while they're at home. And so you are legally bound to those services that are outlined in the IEP. So IEP time, additional permission for group. or for teachers. So if you get that initial documentation saying that the child can participate in the groups, then you're good. You're allowed to utilize groups to provide services. And just remember that even though they're at home, their services should be educationally relevant. And then also, I think I had mentioned this earlier, it's completely different than home-based medical services. So it's two different pots of money. You guys are both able to bill, even though the child is at home. Technically, they're at school. It's a modified school. So please advance.
Thank you, Chris. We'll go ahead and give Nick the floor.
All right, thanks, Chris and Ashley. So assessments, for those of you in districts that are wanting to complete assessments online, you can do it. You can also do non-test METs and just move on with continuing services, and then maybe revisit those later on. But if you are going to do assessments online, they do have, so like sensory processing measure preschool, sensory profile, among others. They have forms online that you can securely email parents or caregivers, and they can fill those out. And a lot of them is automatic scoring as well, which makes it handy. The VMI can be a popular OT tool for visual motor, and you can mail out the actual booklet to the home, and they can do it in the home. You can guide them through the instructions. Of course, it's a non-standardized format, so that would need to go in your write-up, but you can still gain information from that. Hands-on assessments, of course, we're not able to be there and feel tone and range of motion and things. We have to go by whoever is doing the hands-on. So it's going to be the parent or caregiver. And instead of thinking of it as so much of, okay, they have a hard time completing this task because of their range of motion. Well, what is that task, and spend the focus on those tasks that they're having difficulty in, and then that they need to work on, instead of describing the qualities of their spasticity or things that may be holding them back. Observations are always a great way to get data. So you can jump into a Google Classroom and see what each of the students is doing. If you have a couple students on caseload or one student, you can see how they're interacting in the classroom. And of course, you want, when you're doing those observations, you want to be thinking of what it is you're looking at. So when you're in a classroom, you can see everything. You can see the whole student. When we're doing virtual learning, it's a little bit tougher. Our view is narrowed. So you want to make sure that the camera is set up so that you can see all those things, how they're sitting. Are their feet dangling? What's the height of their chair, table, all of that good stuff. So you can work with parents on that, to getting a, so that you can see all of those. Another thing you could do is have another camera. So for those families lucky enough to have a computer and even an online, or like a separate camera or something like that, you could have, if you're doing a Google Meets or something, you can have them sign in twice. And so, or even using a phone as a document camera. So have a camera that's positioned above if you're doing a worksheet or a writing assignment or something like that, but then also using that face-to-face camera so you can see other things that the student is doing. Next slide, please. Goals and outcomes. So just like Chris was saying about building that rapport, if at all possible, and if you're starting with even new goals, it's really great to be able to have the opportunity to start out really slowly with attainable goals that may be more simple than long-term goals that you have for the student, so that that parent or that guardian can build confidence, because they're not used to doing this. And so having, you know, tiny little victories is going to build that confidence. It's going to make it more enjoyable to be in these sessions. So that would be, that'd be one way of building that rapport and that confidence. Families are going to have their own goals, and during the school year when we're doing in person, I don't know about you, but I don't get a lot of interaction with parents. I get interaction at IEP meetings, maybe occasionally other meetings, occasional phone call. But with everything else going on, it's really difficult to have consistent communication with families. And so now this is a great opportunity. How are things going at home? What does your setup look like? What do you need help with? And, you know, not necessarily making an academic goal based on that, but something that could relate to it, that helps incorporate some of those family goals, with keeping it school-based, of course. Mindful of how you measure your outcomes, the level of assistance, of course, and even though this is still school, it's a new setting. It's physically a different setting, and so we need to keep that in mind when we're making our goals and looking at our outcomes. Parents can always take photos, scans of work samples. Same thing with teachers. If teachers are doing, you know, paper and pencil tasks, and they're expecting to see those, they can always send those along to you. Again, jumping into those whole class teacher-led sessions is a great way to see how your students are doing, and that feedback from parents and caregivers. Next slide, please. Sensory and behavior. So, hey, they don't have to be sitting in front of the computer the whole time, right? So in a lot of sessions, you know, parents, students, they're doing them on phones. And so they might, you know, want to be mobile and going around the house, or even doing things outside. So you want to keep that in mind, that it's not the end all be all to have a student sitting in front of the computer for 15 or 30 minutes. You can always start with a sensory task, which could be yoga, stretching, breathing, you know, some heavy work, some hand compressions or something like that. Environmental modifications, because they are in a different environment, so you always want to be considering that and looking at their, even though you're not there, looking at their educational environment and what could help them succeed. Engaging and collaborating with your district's ABS. They are a great resource, and you know, they're already going to be working on issues like this if they're sensory and or behavioral concerns. And of course, just like you do in in-person therapy, if there is refusal or there is just issues beyond yours or the student's control, you just document that. And you know, that happens to all of us. For motor, again, that coaching, that education with the caregivers, parents, building that confidence, starting with, you know, I don't want to say easy, starting with simple and attainable, reachable goals. Environmental modifications, also collaborating with outside practitioners. So a home health OT, if they are receiving home health you're going to need consent for that, but if they are in the home, then that's a great resource for you. Assistive technology, a great time to work on assistive technology access. So with their AAC devices, other devices that they may be using, parent education, and working through that in the home environment. And then you can always model and demonstrate on the other end. Next slide, please. The in-person school considerations, I don't know if anyone is there yet, or no, we're not, because it's August 17th. But this is something to be thinking about for when in-person classes do resume. And then of course, that's going to be dependent on your region and your district. AOTA has a great back to school guide. The link is in the presentation, and you will be able to access that. Or if you just type that into Google, you can check it out at any time. Next slide, please. AT and supports. If you are able to distribute assistive technology to your students within the district, just like as if you were in person, then by all means do that. Of course, you want to follow the protocols of your district with cleaning and sanitation. If they had a specific piece of AT, that doesn't necessarily mean that, okay, they need it because now they're in a different environment. So it's something that you might need to go back and look at the IEP for that. A lot of districts are doing, they're still doing meal service, so parents can come and pick up breakfast and lunch and things like that. That's a great opportunity to send things home if your district is allowing for that. So they can send home tools and AT equipment, things like that. Of course, it's a different environment, so the AT might be different for that. And then here's some state resources for those of you who don't know that you can rent AT equipment from, usually for free. And it is for a limited time, but it's also a nice testing ground. Like, I'm not sure if this piece of equipment is right for this student. So you can rent it for 30 or 60 days and see how they do with it before asking your district to purchase something. Next slide, I believe it's back to Chris.
Yeah, those are great resources. Take advantage of those. Now, there were questions about the Empowerment Scholarship and some of the services that we can provide. And some people are familiar with that, and some people are not. Typically, it's the OTs who work with clients who are significantly disabled or who have extensive learning differences that where traditional school doesn't work out. Those parents have the opportunity, if they disagree with the services that have been provided, they can opt out of traditional school and receive funding for their child under the Empowerment Scholarship that the school would typically receive. And so they can then utilize those funds. It's a certain percent of that money, but it's enough to educate that child for that school year. They can buy curriculum. They can provide certain services that are necessary for that child's education, and that includes occupational therapy. They don't have to provide occupational therapy services to their child. So that really is up to the parent. And so building relationship with parents and helping them understand the value of OT will help. It will help to ensure that their child continues to receive those appropriate services. And so ultimately it is at the discretion of the parent, but the OT will function like a vendor and either be paid privately as a vendor, or they can work through a business who provides those services to parents that they've located. And then the OT would be a subcontractor or an employee and provide those services. They do need to be educationally related, but they don't have to align to career standards, or they don't have to align to educational standards. They just have to be educationally relevant. And so you just tie that into your evaluation and to the services that you provide. And so once you provide that evaluation and you pick up that child who has the empowerment scholarship funds, then you would individually obtain that consent for the telehealth or the teletherapy that you're going to provide. And typically that will be done one-on-one and not in a group setting. And so we have provided a link in one of the earlier slides where you can utilize that format to create your own consent form if that is a service that you'd like to provide for your families via telehealth. Okay, advance. All right, so don't forget to consider that child's graduation. Where are they going to go once they graduate? Post-secondary transition. This is an ideal time to begin thinking about this, especially when you're providing telehealth services and the child is getting a little bit older, because this is a perfect conversation for parents since they're going to begin thinking about, okay, what's life going to be like once this child graduates? So often these children are not prepared for the post-secondary setting. They're not prepared to live independently. They're not prepared to go get a job or to work, and they're not necessarily prepared to go on to secondary education. And so this is an ideal time for you to begin those discussions with parents, because they'll realize that this child, if I don't do something, they're going to be here with me for the rest of their life, and they're going to see their quality of life. And so beginning those discussions about quality of life and transition and that child's capacity and who are they, and asking the parent some of those questions. Where do you see the child as they get older? And so you can begin implementing this in appropriate time. Could even be as early as 6th grade. You can even do, some light career, interest inventories or discussions, with the child as early as 3rd grade. But ensure that at 6th grade and above, that you're talking about some of these things. OTs can conduct transition assessments. They can create transition goals and transition services. By age 16, it's mandated that every child receive a transition plan within their IEP. And so the IEP starts to look a little different. So assert your role in that area and provide those services, because it really aligns with our profession. And teachers and staff are not going to necessarily be able to tackle this area. And so it's a ball that can be dropped during this telehealth and teleeducation period. But it's something that OTs can easily pick up and incorporate within their traditional practice. You can consider things like work readiness, functional capacity, employability skills, any type of community-based activities, even if it's simulated. ADL, IADL, a lot of therapists complain that they cannot incorporate functional activities or non-medical activities within the ADL activities within the school setting, but it can be done if it's aligned to a goal that's academic. So, if it's preparing, so you don't have to align this to the state standards because it's its own section within the IEP. I just saw a question that said, what are some of the state standards that you could align this to? You don't have to. It's a completely separate portion of the IEP. And if you haven't ever seen one, take a high schooler's IEP and take a look through it. If they're 16 or older, you'll see tucked within there's a transition plan, and it includes a section that looks just like present levels, and a section that has goals and activities and who's going to conduct those activities. So it's a perfect place for OTs to get involved in. Also, even just looking at occupational performance and interest and aligning activities to the goals that they already have. So, sorry, my phone is ringing. I would I would include 4 basic concepts or 4 basic evaluations, and then you can spread out from there, but beginning with a sensory assessment. Who is this child? How will that relate to them in the real world? What types of environments do they like? Where a teacher has trouble assessing a child who has a significant disability and finding relevant information for a transition IEP, and OT can find that easily if they know what that child likes and what they don't like, including some of that information that child, their sensory functioning is easy. COPM, occupational performance, those are a good foundation as well. Any type of self-determination. So a self-determination or a self-determined goal could be, what do you want to do when you grow up? What is it that you would like to do once you graduate? Where would you like to be? That's relevant information to include. And just ensuring that you consider that child's interests. And so there's a lot of interest inventories as well that I would recommend. Go ahead and advance. And so here's some great resources for you. You'll find everything that you ever wanted to know about transition by clicking on each of these resources, and this will be available to you. And that is
my turn.
Perfect.
Thank you, Chris. Here's a just brief list of some helpful resources from AOTA. Most of these have been made available for free during the time of the pandemic, which is great. So even if you're not an AOTA member, a lot of these are free, including some webinars. There are some paid content as well. And the last thing that at the bottom, which I think is something that has been hugely helpful to me in trying to find answers for these things, and I'm sure you guys have experienced it as well, Community, which is AOTA's kind of chat forum. So you have to be a member of AOTA to be able to access that. But I mean, even if that's the only thing you access it for, that is so worth it, in my opinion. You can go in, and in the search bar, you can search for keywords that you have questions about, and you can see all these results of fellow practitioners who are weighing in. And then also AOTA employees or some of the professionals with legislation and policy, they also weigh in. So that's a really great resource for you as well. A couple other resources. There is a YouTube channel called Telehealth Share, and some of you may know of that. It's got some great resources from other practitioners, fellow OT practitioners, of what they have learned, and some recommendations. And the first link up here is going to be a slideshow that addresses a lot of the questions and answers that we've talked about tonight as well. A lot of you have asked in the chat what will happen to these slides and this recording. So we will make sure that this recording and the slides are on our website, and we'll let you know when that's the case. So we'll send out an email to let you know that these resources are available to you. We'll also add some other links to our website, and we'll be doing that in the coming days. Before we get to the Q&A, I want to share a few things about how we can stay connected. This is great. We have over 170 people on this webinar, which is fantastic, and we appreciate each and every one of you for being here. I think we've all learned in the past several months that as OTs, we've been very flexible, and we also have to rely on each other. And we all have different levels of expertise, and because we're not getting a lot of clear-cut answers from those who create policy and laws, we've had to figure out among ourselves what the best course of action is. So in order to keep this discussion going, we have a Facebook group, and we invite you to join that. This is separate from our ArizOTA Facebook page. So this group is kind of like that OT treatment ideas group. If you're on Facebook, that's one of the biggest Facebook groups that I'm aware of, where OTs go and ask questions and people weigh in. So please utilize this resource. Ask questions, share things that you've learned, because I'm sure if you have a question, somebody else has that same question. We also have a text message system that we invite you to sign up for, and you just text 27,000, or sorry, text ArizOTA to 27,000, and that will sign you up. We won't spam you. We normally send out texts when really important things happen, or with general ArizOTA updates that are important, but again, we do this less than once a month. So we invite you to do that. And finally, membership. As Evelyn was mentioning, we're all volunteers, and our organization is only as good as those who are a part of it. And we welcome your membership and your support. In order to get the telehealth executive order passed by the governor, that was largely the ArizOTA Legislative Committee and other practitioners that made that happen. So I think, at least for me, I've noticed AOTA and ArizOTA have become much more important in my mind, given everything that's happened, because I recognize everything that AOTA does for us, and ArizOTA also does so much on behalf of OT practitioners and other stakeholders. So we invite you to join or renew your membership. You can use this coupon code and you can get $5 off. So there's a link right there, and somebody else, I think Benjamin, put it in the chat. If you are just like itching to join right now or renew right now, you can go to arizota.org/membership-registration, or you can find a link on our website. Okay, and again, we're on Facebook and Instagram. Join us. And we'll go ahead and now go to a very important part of this, which is questions and answers. So what we'll do is we'll go through some of the questions that were asked in the chat.
Yeah, and Ashley, I have those questions that I think weren't addressed. So I'm just going to go from the first one that I have, and then anyone can kind of, or any of the presenters can chime in. But the first question is, so it has to do with materials on IEPs. The person states that last quarter, we had about 70 to 80% of students lose packets of activities for a few weeks at a time, and or supplies from scissors to vests to wiggle seats. What do we do about this that is legally okay, and what's best for our students, but also isn't continually replacing potentially expensive equipment? Anyone who, if it's not a presenter, anyone can kind of raise their hand if they have the answer to that. Otherwise, we can just keep moving.
Sorry, I thought you were going to answer that, Ben.
I wish, yeah. I don't
yeah. Sorry. So it was about, the question was specifically about if the kids losing items.
Yes.
And it was specifically relating to workbooks, right?
It's yeah, packets of activities.
Create digital, activities that the parents either have to print out or that can be utilized on the screen. I saw a great therapist show me a way to use a PowerPoint, and she made it interactive so that when she shared her screen, the PowerPoint that she had created, it allowed the child to touch and move items on the PowerPoint. So just create, activities digitally that you can share with the child.
Okay. Thank you, Chris. Actually, a question before this also was, has to do with OTAs. So just anyone can kind of address what OTAs can or cannot do in regards to the kind of telehealth area. Is it the same? Is it different? Just regarding specifically like OTAs.
I mean, Wade, I'd love it if you weighed in on this, but I would assume it's the similar or the same.
Yeah, I'm not aware of any changes to the capabilities and functions of an OT assistant as changed by the telehealth mandates. Everything I've read on the board is essentially what we've we're trying to say all along is it's just a different service delivery model. It's not a different service. It is just how we provide occupational therapy, whether that's as an OT assistant or as an OT.
We have somebody who's raised their hand. Shan, I'm going to unmute you, or you can unmute yourself rather and ask your question.
Actually, I was going to comment for the equipment. Just like we do with iPads, we have them sign an agreement that if they damage it, it costs this much to replace a screen or this much to replace different parts of it, or the brick or the cord or different things. And then they have to sign that they're responsible, and so does the child if the child's able. And in order to take those iPads home or even use them within the school, they have to sign those agreements. So if you're going to be sending equipment home and you know the value of that equipment to replace it, then you would have a signed agreement for that equipment saying, yes, you're allowed to use this equipment in the home, but this is the cost if it's damaged or lost. This is the cost to replace the equipment, and have them sign a user agreement for the equipment and put something like that in place, and then they're more likely not to lose it or damage it. That's an option.
That's great. Thank you. Thank you very much for sharing that. All right, can everyone hear me again now? Had some technical difficulties. Next question comes is the Department of Education not requiring changes to the IEP to provide remote services?
That's correct.
Okay.
They have not provided that guidance yet. I was speaking with somebody from the ADE today, and he said that that they were considering putting together a training for telehealth, and we might deliver it through ArizOTA or this platform. I was going to bring it up.
Okay, great. The next question is, would a reassessment be needed when students return to campus?
So that is up to the IEP team, because you can complete a review of existing data through your evaluation. If a student has a specific disability and they're still going to receive those services, regardless of testing, maybe no new, you can just use the data that you already have. It's really a case-by-case basis. So you may want to do that just so that you're not doing a bunch of virtual assessments. But then when students do return, those students who really were new data was really necessary to providing the best services or the correct services for them, then that would happen then. I don't know if anyone else has anything to add.
Yeah, I think that's good. And I mean, of course, if the child came back and they've regressed, when you're looking at that IEP data, you might want to look at, like, if it's significant, you might want to reassess to determine where they're at. But if they have the same skills, I don't think it would be necessary.
Okay. The next question, and I think Chris can answer this one, which is, what are some of the standard assessments you use for the transition?
Yeah, I saw it and I touched on it when I was in there.
Just want to make sure.
Yep, and so it's actually in the chat. And more than actual standard assessments, it's assessment types. So you pick which sensory assessment you'd want to use, which occupational performance measure you'd want to use, any type of interest inventory, and then let's see, self-determination, finding out what the child wants. And you can build off of that and incorporate anything. I mean, there's life skills assessments on top of that, Ansel Casey. If you click on some of the links that we provided, then you'll find out everything you ever wanted to know about transition and OT. And if you learn something new, then come back and teach us.
Cool. Thanks, Chris. This question was kind of answered, but I just wanted to put it out there again. There's a question about masks required for students, children 6 and over, wherein they're wearing masks and doing physical activity, thinking that O2 stats could fall with the mask on if they are working hard cardiovascularly. Do you have any suggestions on how to deal with this? And then I saw one of the answers being, trying to get a pulse ox, but there was any other.
Somebody else had a great answer to that.
Yeah, I don't know if I didn't see the answer, but you could also do a face shield. I mean, it's not going to be as good of a barrier from the virus, but it'll allow for breathing. So if you're both wearing face shields, or if you have a mask and a face shield on and the student just has a face shield, that might help.
Yeah, and then the other, and the other is if it's a major concern, you can ask your district for a pulse oximeter. Next question was, can students join the Facebook group? The answer to that is yes. Yes, and please do.
Ben, on that last one,
yes.
Benji, Sophia actually said you may need to downgrade that exercise.
Gotcha.
Oh, yeah,
and which was a great.
Yeah, I mean, because if you're just thinking that mask is a barrier, but you're also trying to comply to guidelines and making it safe for you and the client, but you're just going to have to alter the session for their safety, I think.
And I apologize if some of these questions have been answered. I'm just trying to go down in order. So I think some people have maybe answered them, but just we'll keep going. Next question is, do we have to rewrite, do we have to rewrite IEPs for distance learning? I understand it would be ideal, but impractical as there would be no time left for therapy services.
I think we had kind of touched on this, in that Department of Ed hasn't given us guidance to do that change. But if there is, if you're not able to deliver those services, or parents won't, then you'll have to change them. Nick, were you going to say something different?
No, I was going to echo that. Yeah, Chris. If you can do your best to fulfill all the goals and minutes in the IEP as written, then do that. If things really need to change, then you need to do an addendum or a new IEP. But I would do your best with what you have.
Okay. Would the district be required to provide translation services for teletherapy when a student is nonverbal and family does not speak English?
Great question. Probably. Somebody else want to weigh in?
Yeah, I would assume so too. I mean, it's necessary for an IEP meeting to have a translator. So I would assume with the session 2, but I don't know.
That would be this is Mary, and just saying, definitely you have to be able to communicate with the parents. And like you said, during the IEP, how other communications are being provided to the parent? Are they already translated to the other language for them? And how is the teacher communicating?
Okay. Sorry, I'm just trying to go through the chats. Will the chats be available for the presentation as well? And I think we can save them, so.
Yeah.
Yeah, we can. So we can put that in. Are consult minutes and direct minutes interchangeable on the IEP?
No.
Okay.
Yeah, no. And Some districts don't even allow OTs to provide consult or write consult minutes. But I mean, if you're talking with a parent about the services and telling them how to deliver the services, and the child is there and the child is included, I think that's, you know, if all you're allowed to do is direct minutes in the IEP, I think that could count because the child is there, especially if the parent is following through and doing what you ask them to do.
Yeah. And so thank you guys for answering those questions in the chat. If anyone else has a question, you can use your raised hand function under the participants at the bottom of your screen. So if you click on participants, it says 138 right now, then you can raise your hand. And if you do, we'll unmute you and you can ask a question. So
there's another question in here, and I'm sure that's a no, but it says, I'm wondering about recording sessions with students for improved documentation, but not sharing it. There's a legal issue with that, correct? Maybe Wade.
Okay, now I'm unmuted. Yeah, I just answer in the chat on that. Recording can be a slippery slope, so really do your homework and make sure that it is kosher with your district and has been thoroughly reviewed. It's just, does it need to be encrypted and all of those sorts of things. You'd want to make sure you dial those in. Certainly those things can occur, but it requires special consideration. I know in our medical organization, we would use like their cell phone to record an exercise, not the therapists and things like that, so that it's actually not on hospital equipment. It is only on their personal equipment. But anyway, just do your homework is really the message.
Okay. More questions from the chat. The governor's guidelines were that schools may have to provide services on campus for students with special education needs who need more support. Does anyone understand how to interpret this? Do we need to provide face-to-face services while schools are still closed?
Aaron did a good job touching on that. Are you able to chime in, Aaron?
Hi, yeah, I think with the last announcement that was made, I think each district is interpreting what that means, whether it's weekly or I think it's their student by student, they're all interpreting that slightly differently.
Okay. Another question is, if IEP states that a child needs something like a compression vest and parents ask for one at home, what is our responsibility as therapists if the item is used incorrectly by the family?
I mean, you've got to train the parent and ensure that they understand and have them demonstrate understanding. That's a tough one because you're not there to see how tight it is. And so that is a good question. Anybody else want to weigh in on that?
Yeah, I would say something similar. I think you can. In our district we have it's a checklist. It's a training checklist of certain things that the teacher or the aide needs to be able to do in front of the therapist, needs to be able to perform in order to get the go ahead to be able to use a weighted vest or a compression vest, and that they're able to stick, that there's a written account of the schedule that they're using, how long is it on, how long is it off. And so those expectations have to be with the parent or caregiver as well. And if they're not collecting that data, or if you are suspicious that, you know, it's not happening that way, then yeah, the decision needs to be made.
Good. And then Jenny also weighed in, like her personally, she would suggest compression clothing, such as Under Armour, instead of a compression vest, because it's less restrictive, or there's probably less liability. It's a piece of clothing.
Yeah, that's great.
And then another question is, if the new developed codes are not specific to how services are being provided, group or individually, how else can we bill for that service?
What, sorry, will you repeat the question? I was looking for it in the chat.
Sure. If the new developed codes are not specific to how services are being provided, i.e. group or individually, how else could we bill for that service?
I mean, they're not, the codes probably have modifiers through your district. And so that depends on what your district is allowing. If the district is signed up to receive those Medicaid, funds, then they have a point person who is working on the coding and ensuring that you guys are in compliance. And so they should have the modifiers in place. If they don't, I'm not sure how you could go in and change it in the system anyway. I mean, I have heard of some therapists who provide strictly telehealth services, and they do use different codes than we typically use in the schools. Medicaid in the public schools, you have to use what is provided to you. Does anybody who was on the call last week want to chime in with the codes that you use for independent telehealth services for kids?
This is Alex. I'm an occupational therapist in outpatient rehabilitation at Phoenix Children's. We've been doing telehealth since about March. The CPT codes that we've been using are typically the same that we would use in person. The interventions, because they're essentially the same treatment through a different modality, the CPT ends up being equivalent. Through our facility, we have been using a modifier that I'm not exactly sure of the specifics of, but our facility set up the modifier so that when the billing goes through, that CPT is automatically indicated as a telehealth code. The only CPT codes that I'm aware of that were not allowed to be used have been the ones that were clearly required you to be in person, which are things like manual therapy, because you're not going to instruct a parent on how to provide manual therapy. But anything like neuromuscular reeducation or therapeutic exercise or dynamic functional activities, all of those things can be used.
This is Barb. I'm in the Paradise Valley School District. I can possibly kind of respond a little bit. That sounds really confident, doesn't it? What we have received from our finance person regarding the codes for us to put into our DSC is basically, typically for OTs, we've either done the individual service or the group service when it's been in person. As far as the actual service time, this isn't referring to the evaluations. And that there is now 2 different codes available for the individual services through telehealth or through telehealth. One of them is if it's done virtually, like on a computer, et cetera, is one code. If it's through a phone, it's a different code. Same way with the group, it's one code. And I don't have it off the top of my head what those codes are, but they're listed in DSC under the training section that we are able to go through, and there's a PowerPoint that was really clearly delineating the information. I thought it was very helpful to refer to.
Thank you both.
And I see one more question here. Is the SPM home form more appropriate measure than the classroom form if OT services will primarily be direct and not include Google Classroom?
So the only thing is I did just send the home form to a parent the other week, and I got some really great data on how they're performing in the home. It's still, even though it's their school environment now, it is still their home environment. and I'm trying to remember the school form, because I think it has a lot of peer interactions and things like that. So I think it's really what you're looking for. I really don't, I wouldn't have an issue with either of them, but like I said, I used the home form and I got some great data.
Kelly had a great point. She said she sent the SPM classroom form to last year's teacher, and gathered some good data that way also. So it's just a time to get creative and adapt and use your OT skills.
I think that does it for all the chat questions.
Wonderful. Thank you, everyone. Again, if we didn't get to your question, please post it to our Occupational Therapy Network Facebook page, or you can email it to office@arizota.org. And likely what we'll do with that is share it to that Facebook page, because I think getting feedback from everybody has been very helpful to this point. We want to continue with that. All right, Evelyn, we'll give it to you to close it out.
I get the easy part. I get to thank everybody. This was an excellent session, and thank you so much, everyone who contributed to this. So valuable. And just remember that it doesn't stop here. You still have us at ArizOTA, and the conversation can continue. And again, consider being a member if you're not. It's a great time to join ArizOTA. And consider attending our fall conference as well, which is going to be virtual. October, was it 24th and 25th? It's a Friday and Saturday.
23rd and 24th.
23rd and 24th, Friday, Saturday.